So why choose a pediatric dentist? Why take your children to a pediatric dentist versus, say, a general dentist who sees the whole family? And really, I think the answer that I can give you that makes the most sense is that pediatric dentists are the pediatricians of teeth. And most parents these days will take their children to a pediatrician, not because their child has needs that require anything special, but pediatricians have been trained to just see kids. And one of the common misbeliefs is that baby teeth are nothing more than miniature permanent teeth, and that just couldn't be further from the truth. And so pediatrics really is for all kids. Whether or not your child is well behaved or afraid of the dentist really has nothing to do with it. Pediatrics is a specialty, and they do extra training to help provide the very, very best care for really children of all ages.
To add to that, I think one thing that parents can expect when they come to our practice is for their child is that everything is catered to the child. Our assistants have special training in how to interact with the children, how to get them to react positively to this new treatment that they're seeing. It's a kid-friendly environment. There's TVs on the ceilings to help with distraction. We have murals painted all around the office to help it seem friendly. We don't want the parent or the kiddo, when they come into our office, to feel like it's a doctor's office. We want them to feel comfortable. We want them to feel like they are our special guest, and this is here for them. And with everything catered to the child, I think that it helps them to be encouraged to have better oral health. It also encourages the parent. I can tell you how many times on a daily basis parents will make the comment, I can't believe that my child got their teeth cleaned. I can't believe my 2-year-old sat in the chair and got the teeth cleaned. And we would love to take credit for that. But, our assistants have just been trained so well that they love working with the kids. And I think that's something that parents and patients can expect when they come into our office.
It's kind of funny, actually, because we have a certain way that we talk in a pediatric office. So we don't perform exams, even though we do. We'll say we're going to count the teeth. Children understand that, and they don't understand doing an exam. That's foreign to them. That may even be scary. And so sometimes parents may react funny or awkwardly when they think all the dentist did was count my child's teeth. We know how many teeth they have. We just have a different way of explaining things in a way that is kid friendly and seems to make it more amenable to them. So one of the saddest parts about pediatric dentists is that our kids grow up and they become teenagers. And not that we don't like teenagers, it's just that kids grow up and eventually they graduate from our practice. And of course, we get very, very attached to all of the kids, and we love them, and we get to know their families and their close friends, but kids grow up. And so parents will sometimes wonder, what age does my child begin seeing my dentist, for example? This usually happens right around high school graduation. Occasionally a child in the early to mid-teens will present with challenges with his or her teeth that a general dentist should address. But more often than not, it's right around high school graduation. And that's when kids graduate. That's what we call it, from the pediatric office. Yeah. Some don't want to. They still like coming where they're coming.
I saw one girl who came to see us for a cleaning, and that weekend she was going to get married. And I told her that her children are welcome to come back, but this is probably it for her.
Right.
So, like Dr. Rupp said, we get attached to our patients. But I guess to talk a little bit more about our practice and why it's special, we cater everything to the children. Special things that parents may encounter in our office, or things that we talk to parents a lot about, are frenotomies, which is releasing of the frenum tissue below the tongue and above the lip. And a lot of times we see very young children for this issue with feeding, It can also keep teeth separated as children grow and their permanent teeth come in. And the way that we do it is very minimally invasive. We use a laser in our office for that, which helps us to not have to place any sutures or anything like that. It's a very quick procedure that's done, and we've done it on several infants, in fact. And that's had a really good result with many of the moms that they've reported back to us that the child has improved their feeding. So I think treating the child from infancy all the way through adolescence, knowing certain warning signs to look for, catering our office to fit specifically for children, and having our specialized, additional training for a 2-year residency in a children's hospital, and working with those kids has helped give us that springboard to know how to best treat those children.
We just love kids here at Salt Lake Pediatric Dentistry, and always feel free to contact our office if you have any questions. We're just here to help.